When you turn this video off, please tell me what the reason for it was, so that I can improve. Otherwise, hi and welcome. I'm trying to learn medicine. Today, aortic incompetence. And after we have done it, we're going to do stretching. And if you participate in the stretching with disability on risk, we're going to talk about the blood system and diseases. And this is now medical advice. And this is the second part of aortic incompetence. And now we're trying to gather the information together about the aortic incompetence and prepare a presentation out of these informations. The aortic valve lies at the exit of the main pumping chamber, ventricle, and should close after each heartbeat, preventing the backflow of blood into the heart. Okay, there's the heart, and there's the left ventricle, and out of the left ventricle there comes the aorta. Came it out of the ventricle or the atrium? I think it came out of the ventricle. It would make sense. And then the aorta comes up and through the arc of the aorta and down into the body. The aortic valve lies at the exit of the main pumping chamber, ventricle, and should close after each heartbeat, preventing the backflow of blood into the heart. Now, let's take one look if there is maybe in this book once a graph of the heart. We could need it maybe a couple of times. We have a little bit of a heart, 5 the aorta, but it's not detailed enough to see the chambers. Okay, now specific like that, but I think it comes out of the left ventricle. But later to it. When diseased, so this valve, which opens to the sides of it, the blood comes into the aorta and closes then again so that the blood is not flowing back into the heart. When diseased, the valve becomes thickened and does not close adequately. Blood leaks backwards and causes pressure in the heart. As well as being incompetent, the valve may be narrowed, stenosis. Okay. The valve becomes thickened, at another place the valve becomes narrowed. We're going to stay a little bit away from that, that is not so important. Also, the video we are preparing is not medical advice. We just want to have what is aortic incompetence. So this valve at the aorta is diseased, and blood is coming back and causes pressure on the heart. Symptoms. In mild cases, there are no symptoms and the condition goes undetected. Okay, that is the first thing. Second symptom, shortness of breath occurs when there is a large blood leakage. Okay, if there's little, it is not noticed because it's just a few drops. It doesn't make much, but otherwise, shortness of breath. Causes. Rheumatic fever as a child, sclerosis or hardening of the valve, infection, congenital abnormalities of heart. Okay, a part of congenital, so born in, congenital infections or sclerosis, or hardening of the valve, and also rheumatic fever as a child. Treatment in the home. Avoid exertion causing shortness of breath. When to consult the doctor if undue breathlessness occurs. What the doctor might do: try to treat the breathlessness with drugs. The diseased valve may be surgically replaced, depending upon the patient's age and general health. Okay, there are medicamentations, but if it is severe and the patient's health allows it, there is the option of surgery, replacing the valve. Outlook. A slight blood leakage makes little difference in the quality and length of life of the sufferer. A larger leak may lead to heart failure, but this may be controlled by drugs. Surgical replacement of a diseased valve improves the outlook considerably, but the operation is not without risk. The book is from the 70s, so it's good possible that the award is no more possible, or better possible. Okay, aortic incompetence. It is with the valve. Is when the aorta comes with the blood out of the heart. We say it like that. I think it's the left ventricle, but at the end it is the atrium, so the left ventricle. We're going to say out of the heart. The aorta comes out of the heart and the valve, closing it after the blood has come in, closes the valve so that the blood is the going to the inside or to the outside. To the inside of the aorta. It pumps, so the blood must come in, and then it closes again. That makes sense. So it opens into the aorta and closes it again. That would make sense, otherwise not. Okay, this valve at the aorta, when it comes out of the heart, that is diseased. And therefore blood leaks back. We would know it can be because the valve is thickened, or not closed adequately, or is incompetent. I don't know what the name incompetent is. Does that mean not completely out to the other side? Or narrowed. Let's say we just it is not working properly. Doesn't close properly. And in my case, no symptoms, otherwise shortness of breath. Causes sclerosis or hardening of the valve. Sclerosis or hardening of the valve, rheumatic fever as a child, infections or congenital, and there is medication and replacement. I have a second camera which I'm going to start now. And now let's try to say it. Aortic incompetence. When the aorta comes out of the heart with a new blood into the body, there is the valve so that it closes after the blood has come in. So the heart pumps and the valve opens so the blood comes in, and then the valve closes so that the blood is not flowing back. By aortic incompetence, it does not close properly for some reasons. The reasons can be rheumatic fever as a child, or sclerosis, hardening of a valve, or infections, or also congenital. So this does not close properly. If it is just a little bit, then it isn't noticed most of the times and it doesn't cause really problems. If it is more, then it can lead to breathlessness, and there are medicamentations, and also is with the option of surgery to replace the valve. That is according to Keith Hodgkin's Family Medical Advisor book on the page 77, but this is no medical advice. I'm going to stop the camera. And that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the stretching, then it's at your own risk. We're having the feet standing together, and we're doing the rooting tree. Go with the toes to one side and with the other toes to the other side. With the heel now and with the upper heel, so open just like that. As far as you can go. And then again in. Always one at a time, the heel and the heel. But this time we're staying down with the head. So we're standing in the knees now. Stay on the same height with the head. And close. And now. Legs shoulder width wide apart. Breathe in and lift the arms up. And breathe out, go over to the side. Breathe in and lift the arms up. And breathe out and go over to the other side. In and up. And out the arms down. Now one sees the acrobatic exercise. Breathe again in and out, and one hand slides down the leg and the other shoulder stays down. Breathe again in and breathe out and take one arm over. Breathe in and out the rib cage and breathe out back into the middle. Breathe again in. And breathe out, and the other hand slides down the leg, the shoulder stays down. Breathe again in. And out, and one arm over. Breathe in and out the rib cage. And breathe out back into the middle. Have the feet standing together. And we're doing the aortic, aeroplane exercise. Breathe in and lift the arms up. And breathe out and one hand down. Now breathe in and reach. And breathe again out. Breathe in and reach high. And breathe out the upper hand down. Breathe in and reach. And out, hand up and both down. And feet again, shoulder width wide apart and shoulder circles. Back with the shoulders up and front and down. One more round. And the upper pair shoulder front, up, back, and down. Now breathe in and lift the shoulders up. And breathe out and let them fall down. Again in. Out and down. Now the apple plucker. Breathe in and lift the arms up. And reach always with one hand high up. Pretend to take an apple hanging high on an apple branch, to turn it a bit around and then to rip it out. And now the shifter exercise. Legs wide apart, arms up to a T, breathe again in. And breathe out and shift just with the upper part of the body over to one side. Breathe in into the middle again. And out over to the other side. Breathe again in. And out we're leaning onto the knees and we're doing the exercise with the name, the buffalo fighting its hangover. Breathe again in. And out, one shoulder in front. In and back. Out the other one in front. In and back. And out, and now we're hanging down. The Niagara Fall exercise. Just keep hanging down. Breathe again in. And breathe out and go over to one leg. Breathe again in. And out, go over to the other leg. Again in. And breathe out back into the middle. And now close your feet. And we're doing the Salto Angelo exercise. Just keep hanging down. Breathe again in. And out. Breathe again in. And out, come slowly with the arm back up and make it the top of it with shoulder drop. Now, the toes are pointing to the outside. Have an ulnar space between the heels. Breathe in and lift the arms up. And breathe out and sink down and place the elbows against the inside of the knees. Breathe in and straighten up. And breathe out and come with the back up. Breathe again in. And out back into the garden pose. Breathe in and straighten up. And now breathe out and come slowly in one straight line upwards. Hands again. And now the seahorse pose. Have a good standing leg. The heel of a marble leg on top of the knee of a standing leg. Do this only if you can do it without injuring yourself. Breathe in. And breathe out and go down. Up again. Change the legs. Breathe again in. And out if you can do it without injuring your knee. And go down. And up again. Legs wide apart. And we're ending with a trunk igniter. Breathe in and go down. And breathe again out. Again in. And out. Again in. And out. Again in. And out. Now breathe in and close the legs. And breathe again out. That was stretching. I thank you very much and until next time.